Now to Michigan, where there are at least 790 confirmed cases. Governor Gretchen Whitmer joins me now. Good morning, Governor. You just heard Governor Murphy explain why he issued that stay-at-home order. The governor of Illinois, which isn't far from you, has done the same. Is something similar under consideration for Michigan?
Well, we've been very aggressive. I was one of the first to cancel school. We moved forward with closing restaurants and bars pretty much at the same pace as my fellow governor, Phil Murphy and J.B. Pritzker and Mike DeWine, Republican from Ohio as well. We're continually analyzing and determining what our next move is. And so the fact of the matter is we're going to continue to see these numbers go up exponentially. The problem that we have right now is that we don't have enough test kits. And I heard your conversation with the man from FEMA. We need test kits because these numbers are informative only to a certain extent. We know that COVID-19 has infected a lot more people than just those who are being tested and testing positive. And that's why in order to make decisions, we really need better data. We're all building the airplane as we fly it right now. We're doing the best that we can. We're going to continue to be aggressive, and we're continually monitoring what the next move we can make is. But we need the federal government to get us those test kits. We need PPEs, as Phil was just saying. We need clear directive and guidance from the federal government. And frankly, a patchwork strategy of each state doing what they can is, we're going to do it if we have to, but it would be nice to have a national strategy.
But given all these urgent needs and the virus is spreading rapidly, as we said, Michigan is up to 790 confirmed cases. Why not get ahead of this?
Well, we have been very aggressive. We are, as I said, looking at and analyzing what is happening here in Michigan, and we're always going to be aggressive and make the best decisions based on the facts as we have them. My team is meeting 24/7. Trust me, we are continually trying to determine what we need to do to keep people safe and to keep our healthcare system from being overwhelmed.
You've said that you don't think the federal government did proper planning. How much of a difference do you think the recent measures, purchasing those N95 masks, will make?
I mean, it's important. We got to have those masks. I am working with companies to purchase masks as a state. Had the federal government really started focusing when it became clear that the whole world was going to be confronting this, we would be in a stronger position right now. And that's an issue that I'm not going to belabor because I've got to keep solving problems, and I would like the federal government to be a partner. I can't afford to have a fight with the White House, but the fact of the matter is at some point we are going to have to analyze where all the failures were, and we're going to have to make decisions that based on what happened and what didn't happen. Lives will be lost because we weren't prepared. Our economy will struggle longer because we didn't take this seriously as early enough as a country, and there are going to be consequences of that. But right now, I got to solve problems, and I need the federal government to help me make sure that I've got what we need for our frontline providers in particular, but also ventilators for people that are going to suffer.
What do you think the situation in Michigan will be 2 weeks from now?
You know what, Martha, it was only 12 days ago that we had our first case, and now we have over 800, around 8 people have died. The numbers are growing so quickly, it's hard to say solidly what we know at this moment. And we've had an infant detected to be having COVID-19. So the thought that this is only one segment of our population that is exposed or in danger is ridiculous. We have to all take this seriously, and every one of us needs to do our part. Assume you are carrying COVID-19 and wash your hands. Practice social distancing. Stay at home if you're not absolutely needed to be outside of your home. And if you do go outside, keep that 6-foot distance from others. We all have to play our part to mitigate the spread and to save our healthcare system.
Good lessons for everyone.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.